Welcome to our channel. Today we're diving into a significant study on Canagliflozin, a drug that's making waves in the treatment of diabetic nephropathy. Specifically, we'll be discussing its impact on patients with type 2 diabetes and albuminuria. Let's explore the findings from the CREDENCE trial and what they mean for patients and healthcare providers. Among patients with type 2 diabetes and diabetic nephropathy characterized by albuminuria and no more than a mild reduction in glomerular filtration rate, Canagliflozin 100 mg daily was shown to significantly reduce the risk of reaching a composite endpoint. This includes end-stage kidney disease, doubling of serum creatinine from baseline, and death from renal or cardiovascular causes. The results were impressive, with a hazard ratio of 0.70, indicating a 30% risk reduction compared to placebo. Typically, the initial management of type 2 diabetes involves lifestyle modifications and metformin. Sodium glucose cotransporter 2 inhibitors, including Canagliflozin, are added for their benefits in reducing hemoglobin A1c and improving cardiovascular outcomes, as demonstrated in the CANVAS trial in 2017. Published in 2019, the CREDENCE trial randomized 4,401 patients with diabetes and albuminuria to receive either Canagliflozin 100 mg or a placebo. The trial was halted early at 2.6 years due to clear benefits with Canagliflozin. The primary endpoint included a mix of cardiovascular and renal outcomes, a necessary consideration to prevent skewing results due to competing risks between these endpoints. Canagliflozin showed significant reductions in various renal endpoints, including doubling of creatinine and end-stage kidney disease. Sodium glucose cotransporter 2 inhibitors can lead to an increased risk of genitourinary infections, including potentially fatal conditions like Fournier's gangrene. The trial reported a higher incidence of genital mycotic infections, especially in males. As of August 2019, guidelines had not yet incorporated the CREDENCE trial results. However, the study adds to the growing body of evidence supporting the protective role of sodium glucose cotransporter 2 inhibitors in diabetic kidney disease. This was a prospective, double-blind, randomized controlled trial conducted across 690 sites in 34 countries. Participants included 4,401 patients with type 2 diabetes and albuminuria. Primary outcomes included end-stage kidney disease, doubling of serum creatinine, renal mortality, or cardiovascular mortality. Secondary outcomes focused on cardiovascular events and overall mortality. The trial was stopped early, which can sometimes lead to overestimating the treatment effect. There was an initial drop in estimated glomerular filtration rate, though it stabilized later. The study was funded by Janssen Research and Development. For those interested in diving deeper, check out the works by Neil B. et al., Bersoff Macha S.J. et al., and the FDA's drug safety information. Canagliflozin has shown promising results in reducing the risk of significant kidney and cardiovascular events in patients with type 2 diabetes and nephropathy. While there are some risks, the benefits appear substantial, marking it as a potential game-changer in diabetic nephropathy management. Always consult with your healthcare provider to understand the best treatment options for your condition.